Good evening to all. The 37th medical term that we'll be discussing today is rapid eye movement. The abbreviation is called REM. It's a phase of sleep. And as the name suggests, it is rapid, so it happens very faster, where there is a random eye movement while you're asleep. And this is attributed to a high brain activity. So there is a exactly it's wakefulness as well as sleep. I mean, you're awake while you are physically being asleep. And also there is a temporary muscle paralysis that is taking place. And the most interesting factor is that there is a chance of most vivid dreams of a person to dream during this particular time. At the same time, this REM phase that occurs during sleep has a or it is linked with the role of learning, memory, consolidation, emotional processing. So let's see individually what are these specific activities. So during this particular phase, there is a high brain activity, a paradoxical sleep or intermittent sleep. At the same time, your eyes tend to be rapidly moving, but your eyelids are closed. But there's a specific voluntary muscle that is temporarily paralyzed. That is what we call as muscle atonia. And what is the reason for that is because, as I said before, we tend to dream during this phase, but because of the temporary muscle paralysis, it prevents acting out of our dreams. And we look at the physiology during this time, due to the high brain activity, there is a high heart rate, high respiratory rate, even high blood pressure, which will sort of be irregular. But the temperature regulation of the brain is suspended. And once again, I highlight that the dreaming would be very vivid and intense. There's a difference between REM sleep and non REM sleep. Yeah, in REM sleep, it's about 60 to 90 minutes after sleeping, but lasts for about 10 minutes. But this non REM is like precedes the REM, so it's before the REM. It's a light, deep sleep. Physical repair, growth, all these can take place. So REM is a cycling process which can last about an hour. 20 to 25% of adults of total sleep time in REM is shown by the adult. There can be some disorders experienced, like REM sleep behavioral disorder, where the muscle atonia doesn't really happen. So they try to act out the dream. Or the narcolepsy, excessive daytime sleepiness, or even the REM reload.